Welcome back to Beyond the Smile. It's been a while, actually. It feels like,
It is.
was it like
Probably a
literally
month.
last year?
Yeah, it was last year, yeah.
But yeah, it's been a while. So,
Yeah.
so welcome back to Beyond the Smile with Dr. Mark.
2025 sounds big.
It
doesn't
does, I know.
It sounds,
It's
it sounds
crazy,
significant.
actually. It is. Lots of stuff is happening.
Yeah.
So today, we're going to dive into when things go wrong.
Awesome.
Because they never go wrong. But so one of the things I think that we've
I
talked
might
about.
not be able to answer those.
Yeah, no, you can.
Okay.
They're going to be dental related. We're
right.
good. So I was thinking about, we've talked about before, you're the, and I don't know if I have this right, you're the club dentist, is that right, for the Kelowna Rockets? What's your actual title? Like, are you like, just the dentist? Well, or you're the club dentist?
Yeah, no, I'm the team dentist.
Team dentist
yeah.
for the Kelowna Rockets. So I thought, that's kind of interesting. We've talked about that a little bit before, and I'm like, so I'm like, being a dentist for a hockey team, I'm sure you've seen your fair share of dental emergencies through that, so you would think.
Yeah.
So we thought we're going to talk about that, and then we're going to talk about what happens when things go wrong. So before we do, though, I'd be curious if we take a little bit of step back, and how did you become the team dentist to the Kelowna Rockets? I don't know if I've ever asked you. How did you actually that ever come about?
Yeah, just honestly, dumb luck.
Okay.
The practice that I joined when I first moved to Kelowna was the team that was taking care of the Rockets at that point in time, and as the older dentist left, the owner that remained behind had no interest in hockey, and so I sort of slid into that space. And then when I set up my own shop, turns out I live 2 doors away from one of the owners.
Oh my gosh,
and yeah, we just have a really great relationship, and they just decided to follow me. So
how long have you been the dentist or the team dentist?
14, going on 15 years.
Wow.
Yeah.
So you've seen a lot of the kids come through. So does that mean you have to be like at every game, or you just have to be on call?
No, somebody has to be there at every
Okay.
game. So on the occasion where I might be away taking education, or in the off chance that I ever take a vacation, then it's incumbent upon me to put somebody else in my place. So.
And you've had to like go into the dressing room because someone got their teeth knocked out? Like, do you literally have to work during the game?
Yep. Sometimes hockey players basically don't want to miss a shift.
No.
So oftentimes it's peace of mind. Maybe you freeze them up and they continue through, or you help stitch people up.
Yeah, okay.
That's typically what happens.
Right.
The actual solving of the chaos, is usually the next day in my office.
Got it.
And that type of thing.
So what do you see, what are the biggest injuries you see, other than the common one, I guess, would be a tooth knocked out, but is that sort of the most common thing you see?
The most common thing is actually cuts, right? So lots of stitches. You'll be cut right through from the outside into the inside. Sometimes, it's not just a chipped tooth. Sometimes they're misplaced. Sometimes you'll get 6 of them that'll get, chopped in half, kind of thing.
Huh.
The worst one I ever saw was super graphic. I've never seen anything like it, but it was a skate blade that came right across the guy's cheek. And I mean, I'm talking layers deep.
And like here, that happened here?
Yeah, absolutely.
Oh, yeah. And you had to stitch that? What do you do?
Well, I was in on that. But,
okay.
I mean, we did some of the stitching, and then we sent him straight to the hospital because really the level of that cut was so dramatic that needed plastics. Basically.
That kid missed a shift, I bet you.
That kid, he missed a few shifts.
I was going to ask what's one of the memorable moments for you, but is that it? Is that the one that stands out? Is there the thing that stands out? You're like, does something happen? Because that's pretty traumatic. But is there anything else that sort of ever stood out for you?
Nah, the only other thing that really stood out to me was a number of years back. It was rocket on rocket crime. 2 kids skating across didn't look at each other, and one kid was absolutely laid out. And that was one of the freakier things that I ever witnessed.
Right.
I mean, he was borderline convulsive.
Wow.
And like just completely out of it on the stretcher. So. Yeah.
Wow. That's scary.
Yeah.
Well, we're not going to go, when things go wrong, hopefully that doesn't go wrong for us. So
when that goes wrong, it's not me solving that problem.
No, fair enough. So we do want to ask, so that sort of sets the tone a little bit about, so non-hockey players at home. So when things go wrong, and what should we do? So I'm out, whatever I'm doing, and one of my teeth get knocked out.
Like completely out?
Sure, knocked out.
Okay.
It's like smacked something. I don't know what I'm doing. I'm being an idiot, and there goes my tooth. What do I do?
First objective is you find the tooth.
Okay.
Assuming you can find the tooth and you can cleanse it, right?
Yeah.
And by that I just mean rinse it off with water. I mean, you're going to have tissues and
Right.
sort of bits attached to that.
Okay.
You totally want to leave all that stuff. And as crazy as this sounds, if you have the fortitude to do it, put it right back in.
Really?
I mean, assuredly that tooth is going to die.
Right.
You know,
Why put it back in?
because the site is a wound, basically, and the wound will start to heal. I mean, the nerve to the tooth has been severed, so for sure that's going to need some attention.
Right.
You know, aesthetically, it may not be the greatest, but it is perfectly conceivable that that tooth will remain, right? If you're not okay doing that, there's obviously a limited window of time. So the two things that, you know, have classically been, what do you do with that tooth, is you either tuck it in your cheek, like you're chewing tobacco, right, and get to the dentist, or you put it in some milk. Yeah.
And make sure no one puts it in their cereal.
That's right. Well, again, hopefully you're going straight to the dentist, because if it's out for more than a few hours, you're going to have a hard time putting that thing back
in anyway. Yeah. So do you I'm going to say the right word, service, but do you service like dental emergencies like that then? So it's like Saturday at 2:00 and my tooth gets knocked out. Do I like, hey, Dr. Mark, I need to come see
somehow I tend to field a lot of them, and I'll actually take the calls, because I always think about myself in that situation. And
right.
If ever I was somewhere and you had an emergency, you would hope somebody would take the call.
Yeah,
hope somebody would help.
Right.
You know, I've had people come down from Big White. You know, they're after a long day of skiing, they're in the pool, and they smack their head on somebody's head.
Not because they drank too much beer.
No, these are usually kids.
Oh, okay.
And so those
they didn't drink enough.
Exactly, and they're the worst ones, right? Because they come with parents that are just like
freaking out.
Right?
Interesting. So what if your tooth doesn't get completely knocked out? You just chipped your tooth. Then what do you do?
Again, see if you can save the piece, because if it's a clean break, believe it or not, and I've done this many times.
You save it?
Yeah. The last one I did was a rocket.
Really?
So yeah, I just broke half a tooth, and I mean, in his particular case, he felt it in his mouth, so he just kept his mouth shut for the rest of he completed his shift.
Oh my gosh, that's hilarious.
but then they put it in and I actually took it from the game and held on to it, and I saw him the next day, and we put him back together.
So it's a silly question, but do you see a line? Like, how do you avoid, like, if you're joining it together?
Well, I mean, the first objective is to try to keep that fragment hydrated, because believe it or not, there's moisture inside your teeth. As they become dehydrated, they become whiter, and so then, yes, sometimes you can see a demarcation, but for the most part, it's pretty slick.
Interesting.
Yeah.
That's interesting. Okay, cool. So what if, and this happens to probably a lot of us or most of us, is that you start feeling like there's a toothache. Like you're just like, where did that come from? Like one of your teeth are starting to, maybe it's a little bit sensitive, or you just feel some pain in there. Like, what's the best way to deal with it before you can actually get to a dentist? Because the easy answer is like, get to your dentist. But in the meantime, what do you do?
Yeah, well, I mean, this might be a good place for Dr. Google, right? Because if you punched in, or to any AI tool sitting next to the master of AI, it'll probably generate a hierarchy of what are the possible reasons, right? So it comes everything from fractures or traumas and the exposure of that second layer, to maybe it's a cavity, to maybe you've been clenching and grinding and you've bruised the ligament, and now, like having a sliver in the palm of your hand, your hand is just achy. Could be, if it's top back teeth, could be a sinus problem. So you just start to triage, you know, what did you notice around there? What are the things that bother it? And you start, you know, crossing things off the differential diagnosis.
It's okay to pop some Advil, Tylenol,
100%.
Take a gummy, whatever you're into.
Yes, it's okay to take Advil and Tylenol.
Not the gummies, got it. Okay.
I'm not going to give dispensary advice.
So what, you mentioned parents before. So if you have a child, doesn't have to be a baby, a child, and their tooth is loose, is it okay to pull it out?
I would hang tight on that, because you want to, first of all, you want to find out, are they at an appropriate age where that tooth should be loose?
Okay, and if it is,
then yes, absolutely.
Then it's fine.
Yeah,
pull it out, and if it's not, then there's more.
Yeah, exactly. So, I mean, it requires a little bit of common sense, but you need to kind of know why the tooth is loose.
I don't have any common sense. But if it's a kid,
again, you may want to consult.
yeah, that's right. Google AI. So if your child is like young enough that they're going to lose their teeth, totally fine. If not, you might want to get to a dentist.
Yeah, I mean the only challenge in and around that is, believe it or not every person has all of their adult teeth. So sometimes you might lose a tooth that you don't have a replacement for, and in which case you might want to know that in advance.
Yeah. Oh, that's interesting.
Yeah. Generally, that baby tooth wouldn't go loose, though. So
right.
That would be odd.
It'd be odd. Okay. What if you lose like a filling? Like, what if a filling literally comes out of your tooth? That's happened before, hasn't it? So how do you? Again, to me, it's like what you should do to. The answer is always get to your dentist, but before you can get there, there's going to be sensitivity. I would assume, if you lose
there
that.
may be. It depends on how big the filling is and how long it's been there and how old the patient is and how far away the nerve is run. Okay. There are a lot of factors, but let's assume you have some sensitivity. You're not going to be able to do a lot to, I guess, hedge against that, apart from just keeping stuff generally away from the area. Okay. And the last thing you want to do is leave anything trapped in there. So then you're going to be sensible about, okay, well, I'm going to try to get like body temperature water. Right. I'm going to be very gentle with my techniques, etc., in terms of keeping that clean. You can go to the drugstore. There are quote unquote temporary filling material things where you can kind of mix it up like a little bit of paste and push it in there. But
so don't glue the filling back in, is what you're saying.
It won't stick anyways.
It won't. Okay. Okay.
Yeah. We put fillings in with dental adhesives, and I often joke and say, "Oh, it's the crazy glue dental edition," but of course it is not crazy glue.
Someone's going home and trying that.
That's right. It has happened, by the way.
What? Someone's tried to glue it in?
Absolutely.
Oh my gosh.
Yeah. I've actually had a person take a Dremel to their teeth and try to do their own adjusting. Which
for real?
Yeah, two times actually, which I thought was just
in Kelowna. Because we're going to call those people out if they were in Kelowna.
No, they were Albertans.
Okay.
Then. Not that it's an Alberta problem. I'm sure it happens here too.
What about, like, sometimes if you're, this could either be from an accident or you're flossing, but your gums start to bleed. And that's happening, I'm sure, I wouldn't say common, but it happens. Like, and again, this is what can you do before you can get to a dentist? Like, if it's an accident, it's probably different than if you're just flossing or brushing and all of a sudden you see blood come, your gums are bleeding.
Yeah, so first question I would ask you is, do you floss all the time?
Okay.
Because quite likely if you don't, you're going to get bleeding, right? Because you're not getting rid of the biofilm. That gum tissue is going to be agitated. Right. That's really inflammation and infection, which is trying to leave your body. Right. Which is why the gums are puffy and red and apt to bleed, right? So the first rule of thumb is if you're new to flossing, focus on your technique, right? I always tell people when they're flossing to kind of rock in from the side as opposed to just snapping it through.
Got it. Okay.
Oftentimes, if you push through a tight contact like that, you just cut right into the gums, and that can be quite traumatic. But as long as you're sort of gently working it in there, you can get in and around there. If it is bleeding gum tissue because you're not great with your home care, if you stick with it for the better part of a week, that will dissipate, right? Other things you can do things like warm saltwater rinses. I'm a big fan of 2 or 4 ounces of water in a cap full of like 3% hydrogen peroxide. Right. Gets quite frothy, but peroxide is basically the breakdown product of ozone, and ozone kills about everything. So you can just go after it that way, and then rinse with water afterwards.
Interesting. So that was my next question: was that when things like this happen, are you okay to just use salt water, rinse, and kind of to help some of that? Or
I mean, the salt water is kind of changing sort of the salinity, pH, that kind of stuff, which is looking to get rid of some bugs that are opportunistic. The peroxide is a bit more direct or aggressive. I mean, you go to a wrestling gym, you're going to find bottles of peroxide everywhere because they're worried about rubbing skin and open wounds and staph infections, and that stuff's great for getting ahead of that.
Interesting.
Quite effective.
if we get some mild dental pain, like when do you know when it's like, again, common sense maybe, but when do you know like you should get to a dentist, and like, and does it happen where like things just happen and then they go away, or is that even mild dental pain means that no, something's happening that you need to get to the dentist?
Yeah, the most common reason for mild pain that may or may not show up and go away and show up and go away quite often is clenching and grinding. So your body has, if you are a clencher grinder, and we won't get into why you might do that, that's a whole different topic. But you're going to have a baseline intensity to that, right? And so I always tell people, stress isn't the reason why you clench or grind, okay? It is 100% the volume knob, okay? So you can turn up the volume or turn down the volume, but you cannot change the station. The station is you're a clencher grinder, and there are reasons for that. Different topic. So you can manage those sorts of things. If it is a clenching, grinding issue, that should dissipate within a few days.
Right.
The mouth is the quickest healing area of the body. So I would say as long as it's manageable, right, and maybe on a downward trend, then you're okay. It would still be something to bring up.
Yeah, because something's causing that. Even if you're grinding, you should probably try to get that fixed.
Yeah, or at least managed.
Managed,
right?
yeah, sorry, yeah.
I mean,
fair enough.
Correction sometimes is a big thing, but protection's viable as well. Yeah, it's more just about maybe being a good record keeper, right? That's the thing that helps us the most, is if you come in, because we're going to ask you a whole bunch of questions. Yeah. If you've sort of thought about things like, hey, what has life been like? What have I been doing? What's different? Have I changed products? We're going to ask you all of these different things, because there's lots of different factors that could create
cause that.
Yeah.
Interesting. We talked about if you chipped your tooth or lose a tooth. Like, what if it's a child that's chipped a tooth, or is your process different, or same thing? Like, try to save the tooth, like.
Yeah, it's a good question. It completely depends, right? Because kids, I mean, even at age 5, can already be swapping over to some adult teeth. So it depends on which tooth it is, depends on how old they are. Oftentimes, if they chip a baby tooth badly, and that's well ahead of the curve of where they would be, quote unquote, scheduled to lose it. Right. Now we're thinking about, okay, we are probably best suited to take it out if we can't restore it. But now what we want to do is maintain the space, right? Because those baby teeth are basically books on a bookshelf. That bookshelf is growing, but we're going to get bigger books, right? And the last thing we want to do is, if you take teeth out, the natural biomechanics of the body means everything crushes the stage, right? So back teeth generally come forward. And now you've got a log jam. The teeth that need space to come in can't, right? And so that becomes an orthodontic problem. And I mean, I saw this firsthand. My first year in private practice was up in Yellowknife, and I had hospital privileges up there. And unfortunately, with the lack of education in some of the communities, you would see lots of kids that would come in. They'd be 3 years old, and they were drinking Coke from bottles in the night. You had to extract all their teeth. So you want to talk about trying to maintain space for an adult dentition that's coming in. It was a nightmare.
That's crazy. Interesting.
Very sad.
So what's the most common emergency that you see in your practice? Like, what are people typically coming in for? Is it lost tooth, chipped tooth? Is that typically what people are coming in for?
It's usually pain. And like, why am I having pain, right? So, you have to, pain is healthy, right?
Right,
your body's trying to tell you, hey, listen, this is not going well, right? You might want to pay attention. If we've left it too long, or people have not been great at, keeping track of that, we have to decide, is the tooth in a state where it's recoverable from the insults that have created this inflammation and therefore pain, or is it something where the tooth is, I joke with my patients, say every tooth has a little black book. And the problem is we don't know how many pages. But it's like, Rod, you had lava cake and cold milk, and you bit down on that seed, and you got a cavity, and you had to get filled. At some point in time, the tooth says, it's enough. I'm going to die. Yeah. Right? And so that's what we're trying to differentiate. Can we pull it back, or is it past the point of recovery?
So if with your patients, if someone does have, because sometimes, emergencies happen, like say your tooth, whatever it is, how do you typically like that handle? Do you like they're literally calling you on a Sunday and say like, I need it, or do you get to the hospital and then, you know what I mean? Like, how do you know when to actually action it to that level?
Yeah. The reality is, as you know,
Yeah.
every single one of my patients, so I don't even know how many that is now,
Yeah.
has my cell number.
Yeah.
Right.
I call them all the time. What are you doing?
Exactly. What are you having for dinner?
Yeah, sorry.
Yeah. So the reality is same thing. It's like if you've got a question, oftentimes you're just looking for peace of mind.
Right. Yeah, fair enough.
The reality is, unless you're bleeding or your face is puffy or it's causing a breathing, the number of true emergencies, or it's a front tooth, which is an aesthetic nightmare, of course.
Right.
There's not that many true emergencies.
But if you smash your face into the ground, you're probably going to the hospital. Like, you're not like, I'm going to call my dentist. Like, you're probably like, don't you think? Like, or not? Or people?
You'd be surprised.
Oh, really?
Yeah.
Interesting.
But I sort of take that as a compliment or a vote of confidence, right?
For because, sure, 100%.
A, people think I care enough to answer.
Yeah.
B, they think I might be able to fix it, or at least direct them.
Yeah, right.
My patients know, as you know.
Yeah.
It's like I always put you in the right set of hands, and sometimes it's not mine.
Yeah. So. Interesting. Well, that was fun. I like that.
Are we done?
Yeah, we're done.
Oh, wow. Good.
You want more?
Let's see. It's all good. It's all good. It was fun.
You want to keep going? But listen, I came up with the best closing for this today. I actually used my friend ChatGPT. I can't take all the credit for it, and I can't wait for this closing, because I thought, considering that we were talked a little bit about hockey and kind of led into this sort of what happens when you have an emergency, because I assume that with hockey you typically will see those sort of things, like a puck to the face, fight, stick, a whole bunch of reasons why. Watch like the Oilers Canucks last week, cross-check in the face. One kid Bouchard lost 4 teeth or whatever. Like, but it's pretty funny actually that they just like. There's one guy I find so funny. It's a totally different topic, but not really. That I think he just got signed by the Oilers, Klingberg, and all his pictures, he's missing his 2 front teeth, and I'm like, would you just not go get some teeth for your pictures? But he,
oh man, I love it. You don't understand what a badge of honor that is for some,
interesting,
especially oddly enough, D guys or people that are like 3rd, 4th line checkers.
They're blocking the shots,
or they're just like, it's like, listen, dude, I'm tough as nails.
That's hilarious. I think it reminds me of Bobby Clark. Like, I remember growing up watching him, like, dude,
celebrating, right?
Yeah, loved it, and it was iconic for that, for his teeth missing. I think it's hilarious. But
I mean, even Wayne's got fake teeth, right?
Oh, does he really? I didn't know that.
Yeah. Huh. You remember Sidney Crosby? He had his
jaw broken. I remember that.
If you look at him now, his jaw's actually. It bothers me all the time.
You're like, I can fix that for him.
Well, it's like, yeah. Anyways,
that's
different
hilarious.
Topic.
That is a different topic. Yeah. But so here we go. Ready? So, athlete or not, if you want to score a great dentist who'll keep your smile in top shape, Dr. Mark and the team at Kelowna Dental Solutions are always ready to assist you. Whether you're facing a power play against dental emergencies or just need a regular season cleaning, they've got you covered.
What about just a great save?
Wait. Okay. Thanks for tuning in, and remember, protect those teeth like a good goalie protects the net.
There you go.
See? That's not bad, eh?
Not bad.
I thought that was pretty good. I thought that was pretty impressive. I asked my friend ChatGPT to come up with a really cool clothing on it, and that's what it came up with, word for word. I didn't change anything. And I'm like, that was pretty good. So kudos to next time. One of these times, you're just going to have my avatar interview you anyway. So I want to be like out on the beach somewhere while you do that. So
I'll put a little transponder here, and we'll just do a cardboard.
Yeah, that's right. Someone in the back just moving the mouth. Yeah. Anyway, so but yeah, thanks for talking again. It was good. We covered some things. Hopefully people, and I hope these actually, I know we joke around, but hopefully when these happen, part of this is like, because this happens. Life happens. You smash your face, your kid falls, your tooth is loose, you have a pain, and you're like, I don't know, you just move on with your day. So I always say that to me, it's the answers, the simple answers, get to your dentist. But in the meantime, when life is happening, it's busy, how do you just mitigate some of that?
Well, equally as importantly, just don't ignore when your body's telling you something hurts, right?
Yeah.
Because it could be serious.
Absolutely. Well, anyways, thank you. And until next time, happy to have you on Beyond the Smile, and we'll see you next time. Thanks.
See you guys.
I was so excited to read my Andy.
Holy foot. This guy. You remember like on Batman?